Good afternoon. I'm Dennis Galucki, and welcome to the 578th Imagine Greater Buffalo program and our 199th YouTube production hosted by our wonderful downtown Buffalo and Erie County Public Library, our Lifelong Learning Center. Thanks for joining us today. This program is created by the Center for the Study of Art, Architecture, History, and Nature, or C-SAAHN, as I like to pronounce the acronym, and ImagineLifelongLearning.com. Now, before we get started, just a little housekeeping. Everyone watching will be muted and your video turned off. If you do have a question or comment, please type it into the chat box and we'll go through them at the end of the presentation as time allows. We are recording this program, so you can watch it again later on the Downtown Central Library's Facebook page and YouTube channel. And please, we hope you share the link with others. Now on to today's featured speaker. Joining us today is Dr. Gale Burstein, the Commissioner of the Erie County Department of Health, to discuss health and wellness in Erie County and some of Erie County Department of Health's recent work. In addition to her role in the Erie County Health Department, Gale is a pediatrician specializing in adolescent medicine and a clinical professor of pediatrics at the UB's Jacobs School of Medicine and Biomedical Sciences, where she also received her MD. Gale leads Erie County's harm reduction initiatives to prevent overdose deaths and respond to other public health challenges. Her team is working on expanding access to health services in Erie County with a health equity approach. As a Centers for Disease Control and Prevention medical officer, Gale worked on adolescent STI prevention programs, policy, and guidelines, and directed the first national rapid HIV testing surveillance program. A great accomplishment, Gale. So let's welcome our guest today, Dr. Gale Burstein. Gale, take it away.
Thank you. Good afternoon. So I am going to share my screen and hope this all works. Okay, and then I'm going to put this in presentation mode. Okay, can you see it in presentation mode?
Yes.
Great. I love when technology works. So good afternoon, everyone. And so today in our Imagine session, we're going to imagine a healthy and wealthy and sustainable community in Erie County. So first, I'm going to talk a little bit about public health and also discuss social determinants of health and how that fits in. Then we'll talk about sustainability and sustainability in public health. I'll give some examples, talk about some new challenges that we're facing in this year and the upcoming years, and then talk about next steps, what we're doing at the health department and what you all can do in the community. So just first, a little bit of background, just framing this all. So we're in Erie County, where we have about 1 million residents. Our urban core is Buffalo, who we all know, and about a little more than a quarter of our population resides within the city limits, about 275,000 people. We are part of the American Rust Belt. However, we have some pretty vulnerable populations in our county. About 10% of our county population are disabled individuals under the age of 65. About 20% of our county are older adults. About 14% of our Erie County residents live in poverty. And almost 20%, 18.5% of children between 18 years and younger actually live in poverty. And those are all data according to the U.S. Census. So first, let's think about what exactly is public health. So there are several different accepted definitions out there by different experts. The way I like to think about it is it's really a scientific, evidence-based strategies or approach for helping a community remain healthy and to promote their health. But you can read the different definitions from credible sources like the Oxford Dictionary, the CDC, and the American Public Health Association. So in Erie County, we we try to achieve this. We collect data every 3 years for our community health assessment, and based on those data, we developed a community health improvement plan, and we focus on 3 priorities. And we do this every 3 years. So our most recent community health improvement plan focused on chronic disease prevention and management, promotion of healthy women, infants, and children, and also promoting well-being and preventing mental and substance use disorders. So right now we're working on our 2025 community health assessment, and then based on those data, we will develop a new community health improvement plan. So we have some various initiatives in Erie County where we partner with community groups because we can't do this all ourselves. And so, Erie County itself has, various programs that we use to improve health and promote health in various different areas. And all these programs, information are available on the Erie County website in different places. So the question is now, what are the social determinants of health? Because these play a very big part in actually driving our health. So the social determinants of health are conditions where people are born, they grow, live, work, and age that shape health and affect our health outcomes. So they're actually the most influential in shaping our health outcomes, more than genetics or accessing healthcare. So the social determinants of health include factors like our socioeconomic status. So, wealth is a big part of this, education, our neighborhood and physical environment, employment, our social support networks, and access to healthcare. So addressing the social determinants of health is important for improving health and reducing longstanding disparities in health and healthcare. And our goal is to achieve health equity. So health equity exists when all people have a fair and a just opportunity to be healthy, especially those who have experienced socioeconomic disadvantage, historical injustice, and other avoidable systemic inequities that are often associated with social categories of race, gender, ethnicity, social position, sexual orientation, and disability. So improving the social determinant of health is central in improving our population's health. So the question is, what is sustainability? So sustainability ensures a harmonious coexistence between human society, the environment, and the economy. It aims to meet needs of the present generation without compromising the needs of future generations. So we want to try to, use our resources to get what we need, a healthy and comfortable life now, but we don't want to exhaust all our resources so that future generations will be without. And so there are 3 pillars for sustainability: these environmental, economic, and social, and they all overlap. So economic sustainability creates a balance between economic growth, resource sufficiency, social equity, and financial stability to promote long-term economic well-being. Environmental sustainability preserves and protects the natural environment over time through appropriate practices and policies, meeting present needs without compromising resources availability for future generations. So, again, we don't want to, use up say all the fresh water on our planet or create terrible climate situation so our future generations won't be able to live comfortably in our community, in our world. And then we have social sustainability that aims to create inclusive societies, reduce inequity, ensure long-term well-being for all people while preserving equity, justice, and safety for all. So sustainability really means maintaining resources and a balance. And sustainability is connected to resilience. So the next question is, what is resilience? So resilience is the ability of a system to prepare for, recover from, and adapt to change or stresses while maintaining our core functions and structure. So the question is, if you have, say, some stressor or some big change that disturbs your operation, how quickly can the system return to normal after this type of disruption? And how completely can we return to normal after a disruption? Can we ever really return to normal? Thinking about COVID-19. And then how well do we overcome and thrive in the face of these challenges? So the key to resilience are adaptability and strength over time. And systems have to be resilient to achieve sustainability. And again, I think back to, COVID. That was a huge stressor on all systems, including public health. And, we really had to pivot and temporarily, drop some of the core programs that we were doing to make sure that people were able to stay healthy and stay alive and promote health. And then, after we were able to recover from that, we were trying to return to normal, but I think we can all agree that life is not the same after COVID-19. So we regained a lot of our like pre-COVID lifestyles and resources, but it's not exactly the same as it was before COVID. So, in all of Erie County government, we have a lot of efforts to maintain sustainability. We are planning for energy efficiency in our county buildings. We have maintaining good stewardship of our county resources. We're always improving our parks, our roads, and infrastructure, and also improving our workforce as economics allows us. The Erie County has a community climate action plan. It's centered in health equity with multiple perspectives that were included. It prioritizes protecting vulnerable communities. And there are many different sections on different aspects of climate, and you can read that. And to go into more detail, you can go to erie.gov/climate action to actually read our climate report and our action report and better understand what we're trying to doing. But we're really trying to take a holistic approach to climate sustainability. So why is sustainability important for public health? So our environment, like our air and water quality, our food supply, our climate, and then different animal vectors like mosquitoes or ticks that carry disease, directly affects our chronic diseases, our respiratory health, our physical safety, and different communicable diseases like from Lyme disease from ticks, or malaria from mosquitoes, or West Nile virus from mosquitoes, and different illnesses from parasites, and our mental state. So severe weather, extreme heat, extreme cold, and air pollution disproportionately impact populations that are poor, homeless, minority, older, and chronically ill. And ecosystems are resilient, and they're up to a point. So damage is done today can take years or centuries to cover, even if it can recover at all. So we have to remember that we have a very fragile ecosystem in our fragile planet. And damage to our environment and stresses on our resources put stresses on humans and our health and the systems that sustain us. So we have to be very, very careful about, maintaining our environment. Some challenges we have to sustainability. First, there's economic pressures. We know that capitalists and corporations have a lot of power right now, and they need natural resources to make profits. And there's really a power imbalance there. And environmental, we have a lot of climate change that threatens to become worse. And it also worsening some of our existing health burdens. And unfortunately, we can expect more frequent and intense, widespread weather-related disasters, more pressure on plant and animal systems. So it doesn't look very good in that future. And then socially, health disparities are linked to poverty. There's systemic and historical inequities, and then there's the social determinants of health. So if you remember one thing from today, we can't opt out of the air that we breathe, the water that we drink, or the germs which we are exposed to. So we're stuck with those. So we have to make sure that we can sustain those, precious commodities to stay as best as we can, so to continue our health and existence. So some, recent stressors that I think we're all aware that we're facing now in 2025 and beyond. So there are federal policies and regulations that have really helped keep us healthy that are being completely abolished. There are structures that are charged with enforcement and oversights that are being completely gutted, like the CDC. There's responsibilities for funding and management that are shifting to state and local governments and from the federal government, and we don't have the same type of deep pockets and resources that the federal government have. Principles of diversity, equity, inclusion are being discarded for uniformity and inequity and exclusion. So we're losing all that ground that we gained in diversity, equity, and inclusion. Funding is evaporating from programs, research, and the workforce. We're losing out on opportunities to create more science. Resources for systems for people's basic needs like food and healthcare and housing are at risk with the 2020 currently proposed 2026 federal budget. And some of the people in charge don't really have the requisite skills, experience, or temperament. And we're dependent on them for our future. So, in face of that, what is next for public health? So, public health has to really step up for this new sustainability challenge. We are incorporating the social determinants of health and sustainability into public health planning and programs as best that we can. We advocate for equity in all areas, for green infrastructure, for public transit, and for affordable housing, just to name a few. We prioritize education, outreach, and communications that actively collect and consider feedback. And we fight back against misinformation and disinformation with evidence-based messages and clear direction. So what can you do? Because again, we really need to rely on the community for, to keep us all sustainable. So we ask people to participate in our community health and climate planning efforts. As we mentioned, our Erie County Climate Action at eriecounty.gov/climate action is accepting volunteers. So that's something that you could do. You could support local food, public transportation, energy conservation, denser development instead of the suburban urban sprawl. And you can stay informed about health resources and emergency preparedness. And most importantly, we have to all work together to fight misinformation and disinformation. That is a huge public health threat. So that's all I have for our short time, and hopefully we have time for questions.
We do have time for questions. Dr. Burstein, I've been doing this for a little over 15 years. About 10 years ago, added a second theme to imagine a healthy, wealthy, and sustainable community. And to do so, I thought you had to imagine lifelong learning. And no one has done a better job of summarizing that theme and showing the practicality of how it looks from a total county's perspective. So my hat's off to you for doing that. You didn't just speak today because that was the theme. It strikes me this is what you do, is think this way, and that is a delight from my standpoint. I'm glad you've been in the position for several years, because the county executive has been there for several years to really get a handle on a bigger picture than just health, individual health. It's communal health, and you express that. If you want to elaborate on that, am I reading you correctly?
Yeah, I mean, we're again, we have to take a holistic view of the needs in the community and think about how we can sustain our precious resources to for people to stay healthy. And I think climate has become a bigger threat, and it's growing every year. And I'm just worried we're going to anticipate another very hot summer. And with it, we see a myriad of other public health threats like, warmer weather, causes people to develop, heat-related illnesses, especially vulnerable population like children's and older adults. We also see, more people opening and closing their windows in old homes, and so we see more people that generates lead dust, and so we see more young children exposed to lead. And this is the summers where we see the most children admitted to the hospital for lead chelation for lead poisoning, severe high levels. And then the longer duration of the warm season, we see higher population of our little critters that cause illness like ticks that can cause Lyme disease through an infection, or west mosquitoes that carry West Nile virus, and other countries, and actually southern United States now, malaria. So we all have to be cognizant of that. And again, with losing opportunities for clean energy, with with all the carbon emitted, it's going to affect people's health in many ways adversely.
Good. I, I don't know how we're doing for any questions. Melissa, I think you're at the controls today.
Yes, we do have at least one question so far.
Good.
So as people may or may not know, Buffalo and Erie County Public Libraries offer COVID test kits for people to take. Could you just talk about COVID in the area? Are people still getting COVID? What are the numbers like for that right now?
Well, I mean, I think we have to think about COVID as just one of the respiratory infections that are in our community all the time, and have some seasonality to it. So, we know that we see, like all respiratory viruses, at low levels in warm weather months where people are outside and they're not all congregated, inside, huddled up close together in classrooms, or in shopping malls, or in closed meeting spaces. But we do have low levels all the time. We're not testing so much, and so we don't hear about it. And then when the weather gets cold, kids return to school. Children are infectious disease vectors, so they get sick and then they bring it home. So so in the fall. And in early winter, that's where we start to see a peak of respiratory illnesses like COVID is one of them. RSV is one of them. And influenza is another. These are all vaccine preventable diseases. So people have the opportunity to change their course of illness, and the vaccines can either prevent infection, or if people do get infected, their their disease will be much, much more milder if compared to if they haven't been infected. So again, just like flu and RSV, we do have low levels of COVID in our area, but fortunately, right now it is low, but it's still there. And just remind people that it's not just here, it's everywhere. And I think one place where I hear a lot where people get infected with COVID is in travel. So one thing that people can do that's not that difficult is when you go to the airport, you travel somewhere, even on a train or a long bus ride or plane, wear a mask. It'll protect you from COVID. It'll also protect you from other respiratory viruses, even the common cold. So, that's one thing we can all do, regardless of the season.
A question from another member of our audience. Do you foresee COVID shots continuing each 6 months for seniors going forward?
Well, we know that right now with our current COVID vaccines, High antibody levels are only present for, a limited amount of time, 4 to 6 months. So based on that, I would hope that seniors would still, or older adults would still have the ability to receive a new COVID vaccine every 6 months. And in addition, COVID is it's a smart virus and it mutates quite frequently. So we need new vaccines, just like we need many years we need new flu vaccine formulations. So many years we'll probably need new COVID vaccine formulations. So our hope is that these vaccines will be available for the vulnerable populations like older adults, young children, people with other health conditions, and anybody that wants a vaccine. I feel that people who otherwise have no contraindications should be able to get a protective vaccine that we know is safe and effective.
Thank you. Another question. The Erie County Department of Health has a webpage about mosquitoes and mosquito transmitted infections, talks about the most effective strategies for maintaining exposure. But people throughout Buffalo are using popular but often ineffective spraying services that don't work, poison other animals in our environment. How can we best get the word out about the best ways to deal with mosquitoes?
Well, I think that, everyone here can be public health messengers. So you can tell your friends, tell your family, download, information from our website or the New York State Health Department's website, or the American Academy of Pediatrics also has some really good information, and share that. But I think we can all be credible messengers for people in our lives.
Going back to COVID, I thought masks were not as effective as we originally thought, but your recommendation makes me rethink this. Can you speak to this?
Yeah, we have really good data that show that masks are very effective in protecting people against COVID and other respiratory viruses and illnesses. And I have to say, whenever I travel, I still wear a mask. I just returned from a trip away last week, and I've worn my mask throughout my airport and airplane experience. And whenever I wear a mask, and when I travel, I do not become ill. So they are, I mean, my personal experience and good, evidence, published data have really been able to demonstrate that masks are very protective if you wear them consistently and correctly. So I see many people wear them like below their nose. So that doesn't help. You really have to have a good seal around your nose and your mouth. So consistently and correctly.
And let me just follow up on that. Do they have to be N95 masks, or any mask will protect you?
Well, I think N95 is the best protection, but any type of procedural mask will also be protective. Cloth masks are the least protective, but something is better than nothing.
Okay. Anything else, Melissa?
Yep. Could you also talk about rabies and bats and any effects of that in our local community?
Yes, we do see bats in our community that are infected with rabies when people are able to catch them, and in a way where they don't crush their heads, so we can send their brains to New York State Wadsworth Public Health Lab to do rabies testings. We do know that we have bats in our community. We have raccoons, I think, is the second most common animal vector for rabies, but we've seen it in like fox, skunk. So, anytime you are exposed at all to a bat or any of those animals, it's carried in their saliva. So we know that. So we're considered that you've been exposed to rabies, and we also know that rabies is pretty much 100% fatal. So it's better to call us if you're an Erie County resident, call us at the Erie County Health Department. We'll ask them some questions and be able to assess, whether you've actually been exposed and are at risk of developing rabies, and we will authorize rabies vaccine. Your insurance will be charged if you have insurance, and if you don't have insurance or you have high co-payments, the county will pick up the cost. So there is no out-of-pocket expenses for Erie County residents to get a rabies vaccine. Well, it's actually a series. It's a few vaccines.
And is there also, do you have any information on people bringing their pets for rabies shots?
Yes, we have rabies clinics for dogs, cats, and ferrets every year in September and May. So we just finished our May vaccine clinics for our furry friends. We'll have another set of clinics in September. So just be on the lookout for that. We share that information with the library.
Yeah. And I think one more question just to wrap it up. How much is the Erie County Department of Health dependent on federal funds and programming? Is your funding in danger? How much of an impact are you seeing or anticipating to the Department of Health?
Yeah, as I mentioned, we are, very concerned. For a while, we thought that because of federal funds that had been terminated, we lost all our public health fellows. But because of the courts, that funding has been reinstated, at least for now. So we have our fellows back. We are concerned about losing our funding for our public health emergency preparedness program. That it was in our CDC contract ends at the end of June. And, CDC has not contacted us about renewing. And in next year's federal budget, the public health emergency preparedness is not included. So we're very concerned about that. We rely on, through New York State, they rely on CDC funding for HIV prevention and treatment, for STIs, food assistance, housing assistance, our, lead programs. I mean, you name it, anything in public health, through the state, the state receives funding from CDC. And if those programs end, I'm not sure what resources we'll have to be able to carry on some of these very important programs.
And just to bounce off of that, is there anything that we as members of the community can do to help, rally against those cuts or support the Department of Health?
Yeah, thank you for that question. Contacted your federal elected officials, let them know how you're concerned about it and how you want them to speak out and vote. There have been some rallies this winter and spring, so people to come out and show that they're angry about the cuts and resources that keep us well. So you could come out for those. I mean, now that I don't anticipate snow for the next few months. So, if there's a rally, it'd be great if showed up so we can show how many people in our community are upset about loss of all these important public health resources.
And I'm just going to drop a link in the chat. Kara Kane, who was on the call, who's also from the Erie County Department of Health, shared a link to 5calls.org, which is a website where you can use to contact your elected officials about these issues. So, Dennis, those were all the questions we had.
Good. I'll wrap it up with an overview question as well. We don't have the large not-for-profits that would be like-minded. Like many other cities, Pittsburgh, I'm thinking Cleveland, but we do have some. How do you connect as partners with like-minded groups? Like most of the nonprofits would understand the language you spelled out about equity and sustainability and issues of that sort. Is there an ongoing way behind the scenes that partnerships get nurtured and fostered by your department?
Yeah, we already have established those partnerships, and we have been working with those nonprofits that are really committed to enhancing and expanding public health. Again, nonprofits have resources, but they don't have the same type of resources as the federal government. So, I know that they will come in and be helpful, but it's not a replacement.
No, for sure. Well, Dr. Burstein, as I said, thank you very much for articulating very nicely and helping us imagine a healthy, wealthy, and sustainable community. I don't think we should shoot for one, but rather all three to make it, because I think all three complement each other. And I trust others will see that connection as well. Thank you, folks, for joining us today. Hope you're back next week, June 3rd, on Zoom, where we'll be joined by Audrey Clark. She's the new executive director of Gardens Buffalo Niagara. We've always brought their folks in to speak in June and tell us about the garden walks that will be coming up in July, and not just in downtown or just on the west side, but now on the east side and throughout the county. So check in with us next week. You'll get an update from Audrey Clark about Gardens Buffalo Niagara. I'm Dennis Galucki. Be well and good day.
Thanks.
Thank you.
Take care.
You as well.